Question number 2, Tanya Unkovich.
Thank you, Mr Speaker. To the Associate Minister of Health, what are the government's plans in relation to Smokefree 2025?
Mr Speaker, the government is committed to the smoke-free target of less than 5% of people smoking daily by 2025. Our plan is to repeal the 2022 smoke-free amendments that have not yet taken effect, namely reduced retailers, denicotisation and prohibition to those born from 2009. We will also build on what currently works and is behind the recent dramatic decrease in smoking and continue to work to prevent young people from starting smoking and vaping. In particular, we will work at education and cessation programs, access to alternative products to aid quitting, and control and regulating access to related products. What's also important is that measures are targeted to individuals and communities that will benefit the most.
Supplementary, Mr Speaker. What particular challenges does the government need to address to achieve the smoke-free target?
Mr Speaker, New Zealand has done very well in reducing smoking. As of mid-last year, we were down to 284,000 daily smokers from 573,000 10 years ago. Smoking is nowhere as prevalent as it was, and we're dealing with a much smaller group, which is great news. The problem is we're dealing with a remaining group of long-term smokers who are addicted to nicotine, so we need to approach that focuses on them and understands their needs and helps them to quit. The progress we have made means there are clearly some current measures such as vaping that work, and I want to build on this and any other practical steps, such as other products used around the world and targeted programs that will help people stop smoking.
Supplementary, Mr Speaker. Are there considerations other than health outcomes that the Minister needs to consider?
Mr Speaker, improving health outcomes is extremely important. However, all government policies need to be able to work and they need to consider real-world impacts. We can't just wish for good outcomes. That means we need to address the real problem we face, which is that current smokers are addicted to nicotine and we need to help them to quit rather than moving to a prohibitionist regime. Cutting supply doesn't equate to reducing demand, and the last government's planned approach was also going to have consequences for retailers, crime and the growth of the black market.
Supplementary question, the Honourable Mark Mitchell. Sorry, you don't sit down until I called you. Do you want to sup or not?
Point of order.
Oh, point of order.
I thought the question was over, but I can wait till.
I can't hear you.
I thought the question was over, but if there's a sup, I can wait till after the sup.
Oh, thank you, thank you. Appreciate that. Dr. O'Shea.
Mr Speaker, with respect to the members' proposals for other regulated products, are there any of those that would not increase the availability of tobacco and the profits of tobacco companies among her proposals?
Mr Speaker, at this stage there are no proposals and I am seeking advice broadly on a range of issues.
Is this a question?
Supplementary.
Sorry?
Supplementary.
Supplementary. Tashkent.
Does she accept the government's modelling that suggests Māori will not reach the 5% national target of smoking prevalence until 2061? Mr Speaker, no, we don't accept that modelling, and it was based on numbers that are not currently reflected.
Thank you. Supplementary, Hannah Rafiti Mapi Clark.
Given that smoking is the leading cause of premature death in Aotearoa, what is her government strategy to rapidly address the inequity and accelerate smoking cessation among Māori to achieve nationwide targets?
Mr Speaker, we're completely committed to targeted programs rather than the blanket approach of the previous government, and we'll focus on those groups with the greatest need.
Supplementary question. Supplementary question, Right Honourable Winston Peters.
Is it the Minister's position that behind this policy is the wisdom of not imposing $8.6 billion of taxation upon Maori since 2011 when it comes to cigarette smoking, or having people beaten up in supermarkets on a daily basis and ram raids and all sorts of illegalities, or the black market, but by following this policy we have taken ourselves to #1 in the world?
Mr Speaker, yes, I completely agree with the Deputy Prime Minister.